Did you know that you're brilliant? That you are an expert? You are the expert on your own body. Now, don't go anywhere. If you have pain, stick around because I'm going to talk about how this, getting to understand the language of your body, is going to help you reduce your pain. So first, why do I say you're the expert? Maybe you don't have the education that a doctor or a chiropractor or any health practitioner might have. How can you be the expert? Maybe you don't know things about your body, like how many bones are in your hand, or how the nervous system works, or how your muscles work. Maybe you don't know any of those things. But you're still the expert because you, only you, have access to that inner voice, your inner wise one that knows your body. If you don't feel like you're an expert on your own body, it's only because you've forgotten how to listen. So today I'm going to talk about how to start to listen to your messages from your body, and then how does that help when you have pain. If you're new to my channel, then I'm Ellie, and I help people get out of pain. I help people who are discouraged and fearful of the future due to pain in their bodies learn core movement practices and optimal breathing practices to help them get out of pain, take charge of their wellness, and then move every day with ease and joy. So back to being an expert. We are listening to our bodies all the time. It might be something as simple as brushing the hair off your face or adjusting your glasses if they're slipping, scratching an itch, rubbing your leg if you banged it into the table corner. All those things are fairly automatic, but it's still a process of listening to something that's going on in our body, interpreting that message, and then acting on it. To deal with pain in our bodies, it's a great idea to get really good at that process of listening in, interpreting, and then taking action. Our bodies are giving us many messages all day long, every day. We have so many messages. We can't pay attention to all of them. Oftentimes we're paying attention to the loudest ones, and those are the messages that are pain. They're really loud because maybe your body's been trying to tell you something for a long time and we stopped listening. I'm going to show you a technique for tapping into that inner expert and learn how to interpret the messages of our body. Do this with me right now. Sit up straight or stand comfortably. Close your eyes. When we close off one of the senses, like our vision, it might enhance your feeling sense. So you can close your eyes, and I want you to take a breath in. However you do it, and then out. You could shake a little if you want. And another breath in. And as you're exhaling, just let your body calm down and relax. Then keep breathing. Take small sips of air in and out. We're looking for nice quiet and stillness in our body. Now, bring your attention to your body. Do a scan. So what I mean by bringing your attention to your body is think about and feel your feet, your legs, your hips, your back, your arms, your head, your neck. Just scan it. Is there one part of your body that has caught your attention for some reason? For me, it's the base of my skull. Once you have your attention on a body part, think about the sensation that you're feeling. Describe it to yourself. Is it achy? Is it a burning sensation? Is it sharp pain? Is it a tingling? Is it warm or cold? Describe it to yourself. And then, once you've described that sensation, and you haven't done anything else yet, think, is there something that you should do? Are you having an urge to do something? Like maybe touch it with your hands? So I want to come up under here and I want to give a little bit of a rub on my neck. Maybe you want to stretch that body part. Maybe you want to move. What is your body telling you to do? Does it want you to wiggle, shake? And there, you did it. Congratulations. You listened in, you interpreted what your body sensation was telling you, and then you did something about it. That's listening in. Now, if you continually have the same areas in your body that are talking to you, that neck or maybe your jaw or a foot, if that is happening habitually, and if you do this practice regularly, every day, multiple times a day, it doesn't have to take very long. Eventually, it will be really fast. Eventually, you'll immediately go, oh, I'm clenching my teeth again. Let go. And it will happen quickly, and you will learn how to relax or how to take care of that body part. And you'll do it before it becomes really yelling at you with pain, because you're adjusting as you go. Now let's talk about pain. If you have had an accident or an injury and it's current, the first thing you're going to do is pause, decide if you need to see a medical professional. Nothing I do here is to diagnose, treat, or otherwise replace medical professional. If you need a medical professional, that's what you need to go do. Go see your doctor. Don't take any of this as an invitation to not see your doctor when you need to. We always have to make that decision for ourselves. If after you've done a quick scan and you're not in panic mode, you might decide you don't need to see a doctor. So here's what you do next. We just went through it. You're going to pause. You're going to breathe. You're going to scan your body. You're going to listen in, and you're going to adjust. Let me show you a little bit about what that means. There are times when my left foot challenges me. It gives me a lot of pain. Pain to the point where I'm walking like this. If that's happening, the most important thing for me to do is stop rushing. Move slowly. So I'll put my foot on the floor, and after I've paused, taken a breath, I will test that foot. And I'll move my knee over the foot and put a little bit of weight on there. And then back off. And then maybe I'll shift a little this direction, and that hurts more. So then maybe I'll shift this direction. Oh, that feels okay. And I will put my hands on my foot and manipulate and massage. I will take the time to take care of my foot. Because if it's in pain and needs some sort of assistance from me or my chiropractor or my massage therapist, it's best for me not to walk on it in its pain place. So I will slow down my schedule. And I know that's not always easy. But if you're to listen to your own body, it tells you, slow down, because you want to keep using your body for a long time. You should slow down when you can. So I'm going to tell you a story. About 10 months ago, I was in the kitchen getting my coffee, and I was tired, and I yawned. And I yawned again. And the second yawn was a really, really big yawn. Look, I want to yawn now. It was a really big yawn. And what happened is my jaw stuck open. And I went into a panic. And I was like, oh, no. And I quickly jammed my jaw closed. Well, that wasn't really the best result either, because then it was stuck closed. I couldn't eat for days, not hard food. I couldn't bite down. I couldn't actually even open my mouth that first day. So I went to my medical professionals for assistance, and I did some of the work that I know that is helpful for my jaw. As a massage therapist, I know these things, so I knew what to do. After maybe 2 days, I could open my mouth, I could eat some things, but that pain in my jaw lasted a very long time. It was weeks before I could eat comfortably, and then it was months before there was no aching left in my jaw. And then just about a month ago, guess what? I yawned again, and my jaw stuck open again. But the difference this time was that I didn't panic. I paused. And I thought, okay, I have some time. I'm going to go in the living room and lie down on the floor on my back. And I did that. And I put my feet up on the couch. And I lay there. And I did some gentle movements all along my spine. I did a little bit of massage and work on my jaw, and I breathed. And that pause, that slowing down and just breathing, adjusted my jaw so it closed, and there was no pain. So compare, that was maybe 15 minutes of lying on the floor doing some things that were good for my body compared to 10 months of aching in my jaw. I think I will try to remember to always pause, decide, and take the best action that my body is telling me to do. So if you have pain, and especially if it's chronic pain, don't panic. Start to explore it. Step back. Feel when, if it's knee pain, is it when I bend it that way? Is it when I try to straighten it up? Explore what is your body trying to tell you. And please know that all situations of pain are different. Every single person is unique. And so what might work for one person might not work for another. And that's why it's important to go inside, listen to that inner expert, and follow the instructions from within. How tapping in to our breath and that inner expert is a way to take best charge of our own wellness. Thank you for watching. Now, I would love to hear from you. If anybody tried this, please comment below. Let me know. Let me know if it worked, if it felt like something that might be useful for you. As I build my video library on this channel, you'll find that there will be videos about breathing better, about moving better, and about pain relief. So if you're interested, please subscribe. Hit the little notification bell and you'll be notified when another video comes up.